While strokes happen in the brain, there are different types of stroke. Sheila Bruce, nurse practitioner, who is the coordinator of the stroke program at Hardin Memorial Health, is here to explain stroke.
Well, Karen, when I think of stroke, you can kind of think of it as a brain attack. Many people are familiar with heart attacks, but a stroke acts on the brain just like a heart attack acts on the heart. There's actually three types of strokes. Ischemic stroke, which is where you have some type of blockage that's caused the stroke. And that's the most common type of stroke that we see. Typically about 80% of strokes are from a blockage or ischemic stroke. There's hemorrhagic strokes, which you can think of as brain bleeds. And there is something that's called a TIA, or transient ischemic attack, which is, some people have referred to them in the past as they've had a mini stroke or a little stroke, or a pin stroke was the old term that we used to hear. But these TIAs are kind of warning signs that you're preparing to have an ischemic or blockage type stroke.
So Sheila, all strokes are a medical emergency.
Definitely.
And they need to seek attention right away.
Yes, definitely.
They need to get through an ambulance, 911, is that correct?
Right. A lot of people think if they're having these problems that they'll just have their family drive them in. And unfortunately, doing that, there's a couple of issues. Number one, if you call 911, you have emergency help available there that can go ahead, let the hospital know you're coming in with a possible stroke so that the hospital's prepared to take care of you. And they also have life-saving equipment in the ambulance in case that you have any complications while you're on the way to the hospital. So definitely call 911. Do not try and drive yourself in.
Sheila, tell us a little bit about the different, when you talked about the different types of stroke, when it affects the brain, it affects different sides of the body. Is that correct too?
Yes, it does. It depends on what part of the brain is affected by the stroke, whether it be a bleeding type stroke or a blockage type stroke. But what side of the brain is affected is going to determine what type of symptoms you have from the stroke. For instance, strokes that occur on the right side of the brain will many times affect the left side of the body and vice versa.
And I think that's very important. Again, if you recognize any signs and symptoms in a family member, a loved one, a friend, make sure you seek medical attention right away. Hardin Memorial Health is an accredited stroke center. This has been Health in the Heartland.